I have a lot of patients who previously froze eggs or embryos as part of a fertility preservation strategy, and now they find themselves in a different place in life. They're ready to start building their family, and they want to know how they should think about their frozen eggs or embryos and what the best plan is. So let's talk about it. Just because you froze eggs or embryos does not mean that you need to rely on using IVF to build your family. My general rule of thumb is that I tell patients to try on their own and think about egg freezing or embryo freezing as a backup plan. You froze in case you run into problems with your fertility, if and should you ever need IVF. Now you've already done the first part by freezing eggs or going one step further and creating embryos and having them ready to go. Being 41 is not necessarily a reason to jump straight to using your frozen eggs or embryos. I would say the age above which I would consider going straight to using what you froze when you were younger might be, 45 and older, because it's at that age it becomes increasingly rare, difficult, and challenging, maybe not impossible, to make a genetically normal or euploid embryo. So I might want to take the path of least resistance at that age. Otherwise, I think that it's perfectly reasonable to start trying on your own, even at 41. Something that I think about when patients are starting to try in their 40s especially is the elevated risks of problems like miscarriage, which we do see at a higher prevalence in your 40s because there's a higher risk of making embryos that are missing or have extra chromosomes. The big thing about miscarriages that worries me as a fertility specialist, aside from the emotional, physical burden of it all, is the amount of time that it can take to get back on the path to trying to conceive. So I worry about it derailing your journey and delaying things in a way that could be detrimental to the overall fertility picture. But if you have these frozen eggs or embryos already banked away, then that's even less of a concern. And that's even more reason that you should feel encouraged to just start trying on your own. And if it works on its own without my help, then that's great. You can follow up with your OBGYN and think about doing a preconception checkup, doing genetic testing to make sure that there's no overlap between the mutations you and your partner carry, looking at whether you're immune or not susceptible to problems like rubella or chickenpox in pregnancy. Make sure you're up to date on cancer screening like pap smears, mammograms. Make sure any chronic medical conditions are under control and you've reviewed your medical history and medications that you're on with your doctor. If you're under the age of 35, you could try for up to a year. That's reasonable before seeking out consultation with a specialist like myself, an infertility expert. If you're over the age of 35, I would say wait no longer than 6 months. And if you're in your 40s, I'd probably try for a max of about 3 months before coming in to do some testing and to consider all of your options, including whether or not to use your eggs or embryos that you froze when you were younger. Now, a quick PSA for someone that has previously frozen their eggs. Maybe they did it when they were single, and now let's say they're older in their late 30s or 40s and they have a partner, but they're not quite ready to start trying to conceive and to actually get pregnant. It's not a bad idea to think about whether you would want to thaw those eggs and turn them into embryos so you can know what you have. You can see how many actually get past all of the different points of attrition and which ones are actually genetically normal. This might change your management, because if you end up having a sharper than expected attrition and not enough embryos to meet your family building goals, your ideal family size, that may prompt you to, at that age, try to create more embryos, which is going to be better than waiting to find this out and then trying to make more embryos at a later time when you may have less eggs and the egg quality is going to make it harder to be successful. Just something to think about.